Ontario Hospital Association is saying that the data they are seeing is showing that we are in a third wave now. I'm just wondering, from the reproductive number that you're seeing in Toronto, as well as the rise in the 7-day average, would you say that Toronto is experiencing the start of a third wave as well?
You know, Matt, to my mind, it's still early to say. Certainly, this is not the direction that we want to see the numbers go in. But as I just mentioned, I think we actually have a great deal of control here. We know what actually makes a difference if we would like to see those numbers turn around. We know that it comes down to those self-protection measures, to really maintaining our distance from others, particularly those with whom we don't live, and as well wearing our masks as much as possible, well-fitting masks, really keeping our distance, washing our hands. I know that these have been said time and time again, but as it turns out, even when we're dealing with variants of concern, with all the characteristics of transmissibility and more serious illness that they're associated with, we know that these measures work. So I just can't emphasize enough that, we have a great deal of power in our own hands, all of us together. We know that we can actually control and limit the spread of variants, and I would urge everybody to continue that vigilance in those self-protection measures.
And I guess this might be a question for both you and Mayor Tory, but when you look at the mobility numbers, you're saying that you're seeing that data is showing that people are moving elsewhere. When you're talking about that regional aspect of where we move next in restrictions, is that what you're looking at to see, people are just going to go somewhere else to do their shopping when you're considering businesses, or would you like to see the province adopt more of a wider approach to the GTA?
So, we know that in the Greater Toronto and Hamilton area, there's a great deal of mobility, between the various jurisdictions, some of which is related to work, and some of that is essential work. So I think we do need to keep an eye on that and recognize that that's certainly part of the picture here. But fundamentally, I think the advice has continued to be, even at the provincial level, to stay as close to home as much as possible. This is the reflection, or that is the manifestation, if you will, of really distancing to the greatest extent possible. So when it comes to what restrictions should be put in place, and whether we're talking about a regional approach, that's well within the provincial purview. That's for them to consider. But I would say that at the end of the day, if people do maintain their distance to the greatest extent possible, that does look like staying at home as much as possible. And when they have to go outside, only going out for those most essential of activities, wearing their mask as much as possible when they're doing that, particularly if they're interacting with others. So, we have much power within our own hands to shape the future. And to help get us back to life more like it was before COVID-19 at the earliest possible moment.